Good morning, good afternoon, and good evening to all of you watching, depending on what part of the world you're watching from. Welcome to this year's presidential address. We are very fortunate to have with us today Mary Woolley as our presidential speaker. Mary is the president of Research America, the nation's largest not-for-profit membership-supported grassroots public education and advocacy organization committed to making medical and health research a higher national priority. I have now known Mary for 2 years, and during this time, I have been impressed by Ms. Woolley's leadership, passion, commitment for the important work she does at Research America. Under her leadership, Research America has earned the attention and respect of elected and appointed officials, researchers in the public, private, and academic sectors, media, and community leaders with its record of innovation and advocacy for research. Ms. Woolley is an elected member of the National Academy of Medicine and served 2 years on its governing council. She is a recipient of the Adam Yarmolinsky Medal for Distinguished Contributions to the mission of the Academy over a significant period. She has served 2 terms on the National Academy of Sciences Board on Life Sciences and currently serves on its board for higher education and workforce. She is a fellow of the American Association for the Advancement of Science. She has also served as president of the Association of Independent Research Institutes. Ms. Woolley has a 30-year editorial and publication history on science advocacy and research-related topics. Her op-eds and letters to the editor are published in newspapers and magazines, including the New York Times and the Washington Post. She has published in Science, Nature, the New England Journal of Medicine, JAMA, The Scientist, Women's Health Magazine, and many others. She is frequently interviewed by science, news and policy journalists, and has received recognition by PBS as an unsung heroine. For her work on behalf of medical research, Ms. Woolley has been honored with many awards, and quite frankly, too many to list as it would take up a substantial amount of this time. What I will say is that all of these accolades that have been bestowed are only bestowed to those individuals that reach the highest echelon of research and advocacy. Ms. Woolley recently mentioned to me that presenting to us this afternoon here at SPR would be much like a homecoming for her, because one of her roles in early part of her career was to work on an NIH-funded prevention trial, the Multiple Risk Factor Intervention Trial, or MRFIT. Mary, we're glad you're home in some respects, and please know that our doors are always open to you. Thanks again, and welcome.
Thank you so much, Willie. That was a lovely invitation, a lovely introduction. And the invitation to come home, if you will, and speak with you and your colleagues all over the world about the importance of prevention and research prevention is a real thrill for me. I'm honored. And I also want to say, Willie, that it's a great pleasure to have you now as a member of the board of Research America. So we have another way of working together where we're trying to really make a difference. And I thank you for the time you commit to our mission as well.
Thank you.
So I'm delighted to share with you some thoughts about your agenda and about how the context of winning hearts and minds for prevention research is important, not only in the places you work and the places that you wish to impact, but it's also important in the town I work in, Washington, D.C. Context matters here, both public and political, small p, we're not partisan. But I want to speak with you for a few minutes this afternoon, and then I know we'll have time for Q&A as well, about a special kind of context, the one that helps drive the future in terms of funding, policies, and enabling you and your colleagues to achieve the kind of success that will lead to better health and well-being for all of us. These are, of course, unprecedented times, but they really call for people like you who've done some deep thinking and work over time about prevention. If only this horrifying pandemic could have been prevented. We're dealing with it now, and prevention research is a big part of dealing with it. I would say that you're needed now more than ever. Look at the way that this pandemic has uncovered unspeakable racial injustice that's really been in place for a long time and has been driving health inequities as well as so many other injustices in our society, in the US especially, painful for me as an American, but around the world as well. So this really is a time that calls for all the best that you can offer and will give. Now, I'm going to say just a few words about Research America in case you haven't heard of us. We are a nonprofit alliance, and we've been around since the late 1980s. We work by bringing stakeholders together, as you can see in this graphic. And we really appreciate the fact that the Society for Prevention Research is one of our members and a partner in much of our programming. Some of the strategies that we pursue for success in making the case for science of all kinds, but that includes prevention and public health research. Our strategies for success are not a lot different than those of other advocacy organizations, but we design them to be especially effective for health promoting and science promoting agendas such as ours. You can see some of the things that we do day in and day out, and I'll talk in more detail about some of them. Now, 2019 seems like 10 years ago instead of just a few months, really. But we had some terrific success stories last year and we're working the whole time in combination with our members and partners and others in the community who care about our issues. So you can see financial increases for the federal agencies that we're especially associated with. You can see successes for the private sector in its conduct of research for health, and can read the rest. It was a very good year for advocacy for medical and health research. You can see here in just this graph of appropriations for the National Institutes of Health over now 30 plus years that the line has gone up at a much higher slope recently, and that's through some determined advocacy as well as congressional leadership, especially, I might add, Republican congressional leaders who have been wonderful champions and continue to be to this day. Now, we expect that dotted line to go up even higher, perhaps within a few weeks, with more supplemental funding. But our underlying goal is to make the solid blue line go higher still, because we're a long way from realizing the promise of qualified researchers, very much including those in prevention research. We need to realize that promise and not be penalizing or ignoring the talent that is what we're all about for the future. U.S. human capital is the name of the game if we intend to be a thriving nation that will be globally competitive. So there's a lot of numbers on this chart, but it shows you some of the things that we track day in, day out about the agencies that we are advocates for and who we are close to but not funded by. We're only funded through the contributions of our member organizations and a few individuals who also support our work generously. Now, currently, the state of play is, one way of describing it, pretty much of a mess. There's a lot of overlapping crises, of course, which rightly are commanding the attention of the public and also of lawmakers. And the Congress is in session right now, may stay through the summer. It's not clear yet. Some things are moving forward in one house, but not the other. For example, the regular annual funding process for appropriations is moving forward well in the House, but it's on pause in the Senate. And the best observers believe that we're going to end up in a continuing resolution, kind of flat funded scenario when the new fiscal year begins, and that will be on October 1st. So the fiscal year 21 starts October 1st. We don't expect there to be a new appropriation at that point. There'll just be a continuation of where we are now. Meanwhile, negotiations are underway in both houses and with the White House on the next supplemental funding bill, and you've maybe seen some of that in the media. It's up and down on a daily basis right now. A lot of push and pull, a lot of failure among members, failure to agree on a partisan basis, as well as failure between the House and the Senate and between Congress and the White House. Very much up in the air. But one of the things that happens when things are up in the air is that advocacy matters more than ever. And that is what this is about. And perhaps you want to even take a screenshot here and scan the code and act now. This is a time to let your representatives in the Congress know that more dollars are needed for recovery of research. While research projects of all kinds have been put on hold, sidelined by the pandemic, dollars have been used sometimes in other ways or sidelined for other purposes, or just not made accessible, especially as fiscal years move from one to the next. It is a time for more supplemental funding, and it's also a time to make the point that prevention research requires more support in order to deliver on its promise. Don't hesitate to make that case and make it to the person or people who represent you, regardless of whether you voted for them, and regardless, even if you aren't an American citizen, these are still people who represent you in the US Congress. So kind of overview of what we all must do together if we're going to make prevention more valued. It does mean we have to engage. We can't hang back in the ivory tower. We can't let journal publications be the end result. We've got to get into the business of talking about the solutions that prevention research has and will continue to deliver. And that message can be driven during an election season in an especially powerful way, I believe. And we've found out now with virtual town halls just how time and resource efficient it is to drop in on a session with a candidate, raise your hand, be part of the chat box, ask a question, be heard. This is our time. Our former chairman, who when he was in the Congress, was more responsible than anybody else, although it was a team effort, but he was more responsible than anyone else for doubling the NIH budget in the late 90s, early part of this century. And he often makes the point that this is about getting involved. Things can change, even when things look very dire. Things can turn positive, but it does mean getting involved. Now, one of the things we do, you may have noticed in an earlier slide, is keep a finger on the pulse of public opinion. And you can see here that especially if you combine very important and somewhat important categories, overwhelmingly, Americans think scientists should inform their elected officials about their research. And I don't mean send them a copy of your latest journal article. I mean find a way to explain in 3 sentences what you're doing is all about in terms of serving the public's interest. I'm going to say a word about interpreting public opinion polling here, not just for the work that we commission, but in general. You should always combine the positives and the negatives, look at them together. We watch the trends within those, but the main top line is looking for the difference between the positives and the negatives. So you can see here that statement I made about overwhelming wasn't about 51%, it was about 51 plus 34. And that is the way you should, in generally, read public opinion surveys. We know that constituent voices, and I mentioned them before, are mattering quite a lot right now. The team I work with spends, some of them spend some of their time, used to be literally on Capitol Hill, but now they're doing meetings virtually, plus many calls, and they've actually found that there's tremendous receptivity and interest. People are hungry, I'm talking about staff primarily, hungry for information from reputable sources to inform their member of Congress, or the member themselves sometimes contacts us, to be sure that they understand the state of the evidence, the state of the science, and are better prepared to make very hard decisions. And being an elected member of Congress is a very difficult job with a lot of responsibilities. They need to know who to turn to for trusted information. Now, we like to say that elected officials and scientists have something in common that you might not think about. You think about the person who represents you, or really three, your congressperson and your senators. You may think you have very little in common with that person or persons, but in fact you do. You all serve the public's interest, which is a fabulous way to start a conversation, to send a message, to engage in any format with someone who has been elected to serve the public's interest. It's by saying that you serve the public's interest as well. And if you stay focused on that as the anchor of your message, you're going to get the attention of that elected official who will ask you questions. And that's what you're going for, is to have a real dialogue, not give a lecture. So we know also that a strong majority of Americans think scientists, that's you, and people do think of anyone doing research as a scientist, that scientists should inform the public about your research. Not just, again, not keep it to yourself and not only tell policymakers, but speak out on a regular basis, formally and informally, maybe to people in your family who don't really understand what you do. If you start talking in ways about working in the public's interest, maybe they'll ask you some questions, and not just the ones about, what's that word epidemiology mean again, but rather, help me understand how what you do serves the public's interest and what I can do to help you succeed. And that's winning hearts and minds. So there's another thing that elected officials and scientists have in common. You all love data. It's just different kinds of data. They actually don't probably want to see the data from your journal article. Now, President Lincoln captured this beautifully. This is about the public and political context of research. Public sentiment is everything. With public sentiment, nothing can fail. Without it, nothing can succeed. That is really the reason that we've been commissioning public opinion surveys for 28 years now. And our methodology is pretty much the same as all the media surveys that one can hear about every single day of the week, every hour of the day, if you like, but also like Pew and the National Science Board and Kaiser and others who are periodically commissioning or conducting surveys. So we, almost every January, we conduct a survey, a general one, and pay attention to trend data. This is the most recent update was December of last year, but it's essentially, the first of the year. And you can see over time a decline in the percentage of Americans who feel that we're making enough progress in health research. We have just felt that this was very concerning for a long time. It's actually can be turned into a message for why we could be making more progress if we had more resources, supporting research across the board, but particularly supporting prevention, behavioral research, eliminating health disparities, some of the things that are not only driving disease and disability at an out of control level, but are also costing this nation so very much. My guess, and we're going to be asking this question again soon, my guess is the percentage who say yes is going to go down again. And that's a sad reality about the fact that people don't think we're making enough progress to defeat COVID-19 and the pandemic widely. And they're right. We'd all like to be making more progress. Once in a while, we ask about whether people favor doubling funding for medical research. This was done once before, as you may recall. We're seeing strong support. We were at the beginning of January for this. It's just kind of interesting. We didn't do anything with that. We didn't mount a campaign. We're just keeping an eye on it, a finger on the pulse. And things may be very different now. People may be ready for substantially more than doubling, in fact. Wouldn't that be great? Another piece of data. People, again, in very strong, high percentages here, want more research in order to help understand and eliminate health disparities. Americans are fair-minded and see the problem. I would posit that they see it now more than ever before. And we will be pursuing that line of questioning going forward. People don't think that public investment in mental health research is enough. Only 25% say it's the right amount. That's not a very high percentage. And I think everybody, certainly my colleagues and I, don't think it's anywhere near the right amount. We've done some questions about substance use abuse and all the many related topics around it. This is just one indication that people have some mixed views about this. Matters where you live, what your sense of the problem, the level of problem in your own community. That's not a surprise to anybody I know listening right now. But watching this over time and how people respond has also proven to be of interest. And we have more data on all these topics, these general topics, available on our website or directly from us if you want to contact us to see what else we have amassed over time. This one is about supporting gun violence research. As you might expect, those who identify as Democrats are more likely to agree, and Republicans less likely. And there's some other demographic differences here, but I was overwhelmed by the very high percentages of agreement. I'd like to believe, and we do advocate for more research in this regard. I'd like to believe that can happen going forward. Now, since the pandemic began, we haven't commissioned any surveys, although I do believe we will next month. So check in with us in 6 weeks or so as we evaluate our findings. But we do know from Pew, this is Pew's work, that there's been an increase of confidence expressed for medical scientists since the time of the pandemic. And you can see over here on the right side of the display that those having a great deal of confidence in elected officials is down even lower than it usually is, in low single digits. And I'm sad to say also that the media has gone down a bit too. We need a vital, healthy, trusted media in this country. And some of what's going on right now in that regard is disturbing. But good news for science is that there are high levels of public confidence, and there have been for some time. But there's a problem, and that's, you could say there's many problems, but one of those is that scientists are essentially invisible in our society. And what do I mean by that? Well, we ask people a question: can you name a living scientist? We've been asking this for 20 years at least. So that's the question. So most people, 3/4, say no. They just say no. They don't guess. They don't name somebody who's dead. They just say no. Another quarter, and this has gone up, and we're really delighted with this. It's ticked up a little bit. Another quarter now say yes, they can name a living scientist, and this is who they've named. Plus, you can see a smattering of others who is just one person named. I think that if we ask this question today, Tony Fauci would be at the top. Some other names we've seen in the news from public health and from medical science. But we don't know. It's a testable hypothesis, and we're going to test it very soon. But the main point is that 75% for years and years and years, sometimes higher percentages, say no. That's that invisibility point. Well, how about this? This is arguably, of course, much easier question. Do Americans know where medical or health research is conducted? So the question is, can you give me the name of anywhere that medical or health research is conducted? Anywhere. This is not hard. My state university, the medical center down the street, which may or may not be true, but it's not hard, but it's not a hard question, we would say, but it turns out to be very hard for half, roughly, of the American public. Although this also has gone up recently. I think partly that can be attributed to very strong marketing by a few high-profile medical centers that do, in fact, conduct research. But there may be other factors as well, and this also may have changed by now. We shall see. Finally, without going through the setup here, unfortunately, 2/3 of the public do not realize that medical research is conducted in all 50 states. That has a tremendous political importance, because if we expect to have more members of Congress voting for more medical research of any kind, it helps a lot that they know that their constituents care. And they are not typically hearing from constituents in their own states about the importance of research. They may hear from those at the state university, let's say, but they're not hearing on a regular basis, in virtual town halls or otherwise, about the importance of research right there at home in South Dakota and every other state in the union. So it's part of your job, and we join you in it, but it's your job too, to work on increasing the visibility of science. By telling the right story, which is the story of the beneficiaries of research. It's their story, not your story, at least leading with their story. That's that I work for you, I serve the public's interest. It's changing the narrative, starting with the why rather than the how or the what of what you do. Why do you do what you do? Talking about it in emotional ways, saving lives, making a difference, preventing disease and disability and all the terrible, tragic costs that go with it. Human tragedy, human lives, families disrupted or worse. Talking about who the adversary is. That's the common enemy. What are we trying to defeat? Of course, we're trying to defeat the pandemic, but also health disparities, and telling a tale of adventure. And that you do have an adventurous career, and talking about it that way in an way of excitement. People want to help you succeed. We have a simple frame that we recommend for talking about any aspect of science. It's called Then, Now, and Imagine. And I chose my own field that Willy reference to when I started my career, I was working in a primary prevention trial for cardiovascular disease. And a lot of progress, in fact, has been made. Now, I didn't start in the 1950s, by the way. I'm old, but not that old. But there has been tremendous progress. There's more to come. And that's just in cardiovascular disease. There's so many other ways that prevention is needed in order to put a whole raft of challenges to health in the history books where they belong. This is a very simple, easy framework that you can use with your work with just a little bit of practice. No paragraphs. Try to stick to phrases and a sentence at most. You can be an advocate anywhere. We used to have pictures of people in their desk in their office. I'm sitting in my office today, partly because I know I have reliable internet. It's not so reliable from the couch in my living room. But that's where I do a lot of my work today. And some equivalent of that is probably where you're doing your work. But there are ways to connect and to make a difference. And Research America can help you do that. We want to help you do that. We want to learn from you. We also want to be your partner in advocacy. We have a program that is operating on many campuses around the country and now has gone virtual. These are some examples from it. And we actually provide micro grants to young scientists, postdocs mostly, but also those earlier in their training. And if you'd like to know more about that, I encourage you to check it out on our website. We're moving into an election, I mentioned that earlier, and we're ramping up a voter education and candidate education program, as we do in every election cycle. We have lots of partners in this year, so that we're going broad science, not only medical and health research. But I encourage you, again, to take a look at our website and sign up for alerts so that you can get engaged with as little or as much time as you can spare. I also want to encourage you to drop in on our virtual National Health Research Forum at the first part of September. I'm delighted to say that Dr. Prado will be participating in this as one of the judges in the Flash Talks competition. We're going to have spectacular speakers from across the federal agencies, wonderful moderators like Judy Woodruff and others, and some special surprise superstars too. I encourage you to drop in. This is free to you, and we encourage your attendance. So just recapping about the importance of the public and political context of your work. It's important to think about who's your audience, what do you have in common. If it's an elected representative, you're serving the public's interest, both of you. Try out that then, now, and imagine framework. Get involved, be visible, be emotional in that sense of owning and caring about what you do. Remember that if people are skeptical, they're thinking about scientists. It doesn't necessarily mean that they want you to fail. They want you to succeed ultimately. They have questions, and that's okay. If you convey your commitment and passion, chances are you're going to make friends for you, not only for yourself, but for your science and for science broadly. We hear stories about that happening every single day. It is about engagement, putting a face on research, not being invisible or opaque. Put your face on it. And remember the 4 most important words that a scientist can say and convey. I work for you. When somebody you meet for the first time, or you're just joining a Zoom and you don't know anybody else, and someone says, well, tell us about yourself. You should say first, maybe not that you're an epidemiologist or a statistician or a social scientist. How about saying, I work for you? And see what somebody asks you next. And my prediction is you will make a friend. You will win hearts and minds. Research America is very fortunate to work for and with the research community, for you and people like you, day in, day out. Indeed, I work for you, and I'm proud of that. Thank you for listening.
Thank you so much, Mary. Appreciate you presenting today. Wonderful talk.
My
And I
pleasure.
always learned something from listening to you. So thank you for that. There are some questions already that are coming in through the chat. So I'll start with the first one. It appears that Research America focuses its work at the federal level. What role do you think that state level policy advocacy plays, particularly for prevention?
Oh, first of all, it's correct that Research America is primarily focused at the federal level. But many of the principles of advocacy, if not all, apply locally and statewide. And when it comes to prevention, my goodness, it's hugely important. Communities are, in many ways, the bedrock of effective prevention. And so it is, while it's not our main focus, we simply don't have the bandwidth to work in states and locally as well as federally. But we're entirely supportive and sign on to things and try to keep informed about what's going on and what's effective at the state level. So I encourage everyone whose focus really is more local to keep at it, do that good work, but take a minute also to weigh in as an advocate on the federal level, because a lot of the money that ends up being spent in the state and the local community does start with federal tax dollars, and that means the Congress makes those decisions.
Great, thank you. Here's another question. How do you recommend that we advocate for increased research funding that increases the community's engagement in research in all phases of research?
Right. So, great question. First of all, the fact that PCORI now exists, the patient-centered, help me out here, patient-centered Research Institute. There's a word missing there.
Yes, it is.
Sorry. The fact that PCORI had to be created, first of all, is a comment on the failure of the research community, the ecosystem of research, to not adequately engage the community. But it has happened. Things have gotten a lot better. I can tell you over the course of my career, it's hugely, the research community is way more involved with the community at every level. And I was actually part of a program at the NIH some years ago to make sure that the NIH at all levels was listening to patients, and listening to the community is another level of that. It's got to happen. I'm a big fan of the South African disability community's aphorism, quote, "Nothing about us without us," unquote. The way we should be thinking about all research from the get-go, from the choice of the study to the design of it, to implementation, participation in it, to interpretation, report out, and applying the findings. So things are getting better, and hopefully with more pushes, that momentum will carry us through to broader and broader public engagement.
Thank you, Mary. And certainly lots of our members do community engaged and true community-based participatory research.
Great.
And actually, the O stands for outcome in PCORI. So there are several more questions that are coming in. Next one is, what are your thoughts on how we can address the current attack on science and possible shifting public sentiment towards science?
Yeah, again, another wonderful question. I think that connecting with non-scientists about science starts with individuals becoming determined to make the connection, literally, to not be invisible, to not count on other people to do it for you, to be humble, to say, I work for you, and listen to the questions. And you're going to run across, if you do this on a regular basis with people you know and people you don't know. I always recommend starting with people you know who either have given you skeptical responses for years. Maybe it's a relative who is doesn't like the fact that federal dollars, their tax dollars, go for what she or he may think of as nanny state-related prevention research. Nobody can tell me whether to smoke or not is a classic example. Or can't take away my guns. Not that that's what the public health community wants to do. We're trying to work toward safe use of firearms, I would say. But without distracting myself, the point is find out what the questions are. Be humble in listening. You may not be able to answer them all. You may not be able to convince someone to your point of view, but you're going to find out what people are really thinking. And we know from work that the Wellcome Trust has done globally that one of the most powerful drivers of lack of trust in scientists is the belief by members of the public that science will not have any useful value to them, will only serve the interests of other people, perhaps people who are defined as elite or wealthier or have more advantages. But if people don't see and feel research as benefiting them and people they know, why would they trust it? So we each have a role, and the ecosystem of science itself, the whole system, has a role as well.
Very good point and true, Mary. Thank you. Another question. With the COVID-19 crisis, structural and historical social injustices in the U.S. became blatantly clear. What are the specific actions as prevention researchers you consider we should focus on particular urgency?
Right. Well, again, a wonderful, appropriate question. I think what we all can do is not allow ourselves or those we work with to make excuses anymore or wait for other people to take action. You have to figure out your own action agenda. Before talking about mine and Research America, I want to mention something that I think is extremely important. The AAAS, under the leadership of Sudha Parikh, who just took over as CEO in January, has made an extraordinary commitment to changing the way it functions, the way it hires and promotes, and to making a difference in the broad science community to overcome, frankly, long-standing injustices. There's much more that needs to be done, but his courage personally and his commitment really come through. And they just announced that program this week. It's on the AAAS website. At Research America, those of us who participate in programs serve on panels and so forth, have all taken a pledge to not say yes to any kind of program that unless it adequately represents the full community in terms of diversity of all kinds. And we don't want to back away from the fact that the really urgent problem is around Blacks. And failing to own that and to say, I'm going to do something about this, educate myself, listen better, make sure that if I have the things that I have control over. So we all need to focus on it urgently.
Thank you, Mary. So many of us want to get our prevention research message heard. We want to translate our findings into practice. And you mentioned that 94%, if I recall correctly, 94% of staff Congress wants us to do that in person with them, what would you tell someone who says, well, I have never gone to visit my congressperson or or someone who works for the congressperson or the senator? How do I take that first step? I've never done this before, and I don't know that I can do this effectively. What would you say to someone like that?
Right. Well, several things. Thank you for the question. So, first of all, remember who works for whom here. That member of Congress works for you. Not that I recommend saying, hey, pay attention to me, but rather to just sort of settle your thoughts in terms of the value of that outreach. So right now, I think it is arguably easier now than ever before to engage with your elected representatives. And I'll tell you why. And this isn't one-on-one, but boy, is it a way in. Right now, everybody who's running for office in November, which is every single member of the House, and about half of the Senate, with a combination of those who are up for re-election and those on empty seats. All of those folks are running virtual town halls, practically weekly, if not more. Anyone can join those virtual town halls. Now, some of them are for those who are giving donations, raising donations, but some are open to the public. So if you sign up for one of those virtual town halls, you might be one of 50 people, you might be one of 20 people. You don't have to say anything the first time you try this out. You can just see what it's like to be on a Zoom with a member of Congress. Then you might think, oh, I think I'll put a question here in the chat box. And if, let's say, whoever is moderating gets 5 questions about prevention research, the odds are you're going to ask that member of Congress that question because they can see it's of interest to the audience. So don't just stop in on one of those virtual sessions. Get your friends and decide in advance that you're going to ask very similar questions. So that's an easy way in, Willie. It's also, frankly, not difficult to get an appointment. Formerly, you try to get that in person, but now get a 15-minute telephone call or Zoom appointment with the person in your congressperson's, the individual, the staffer in your congressperson's office who's responsible for health and science type issues. So there's different, depending on what committees member is on, they may have different staffers with different kinds of titles, but there's always somebody who's covering health issues for sure. So you find out from the website or from Research America or from the Society of Prevention Research or Prevention Research, who you might want to reach out to within an office, but you don't even have to know that. You just call the office, ask the person who answers the phone, say that you're a constituent and you would like to talk to the staffer who handles health-related issues. And they're not going to say, go away or hang up on you. They'll find a time for you to do that. You might have to wait a little bit. They might ask you more questions, but it's nothing that you can't handle. So just do it.
Thank you, Mary. Great advice. I'm sure that some on the Zoom, on the call, on the virtual call, will take you up on that. Additional question. So to your point about public trust and understanding the value of science, does Research America try to help policymakers understand scientific rigor? Example, randomized trials, peer review. How do advocates communicate that message without distracting from the quote unquote story?
Yeah. Well, again, a great question. This is not a one size fits all conversation. So it does depend who you're talking to and what the context is. It's back to the theme of your meeting, which I do think is brilliant. know your audience, know the context. So if this is your third conversation with a staffer for your member of Congress who has expressed interest in learning more about, let's say, the funding problem for prevention research. And maybe they have some questions like, how do I, prevention doesn't pay off right away. Or maybe it's not going to pay off at all during the time my member, the person I work for, is even in the Congress. So I want to make sure that our dollars that we're allocating here are the ones that are going to pay off. Are we wasting money or not? So there's versions of questions like that all the time. So that's the opportunity to talk about quality control, if you will, which is what peer review is about. And is it perfect? No. And the idea of trying to make it perfect or trying to make science perfect is a fool's errand. There are mistakes made. You've got to acknowledge that. But they aren't, they're a tiny exception, not the rule. And that's the time to talk about peer review. Randomized trials is also a topic of great public and policymaker confusion, for sure. And that comes up more often, I would say, than peer review. But randomized trials, I like to describe as the way that everybody, in a perfect setup, everybody would be involved in science, in prevention research, all the time, every day, mostly passively, by allowing the use of data about you to be used by researchers. If everybody were involved, there'd be a lot fewer problems trying to recruit to trials. That's an aspiration, one that we work on periodically to try to figure out how to leverage and get into that mode. But a step in would be an opt-in, like organ donations on driver's licenses. Before that was there on a driver's license, it wasn't. So somebody thought about how to make something important happen, meaning more organ donors. And similarly, I would say that community needs that kind of breakthrough thinking to be sure we can recruit more robustly to randomized trials. But we do have a ways to go on it. And we also have to, I would say, align with first-line providers, physicians, nurses, and others, to talk more often about research and about what a randomized trial really means. It doesn't mean you get person in the trial gets the better treatment and somebody else gets nothing, or you get a high-risk treatment or nothing. I don't have to tell you. The messages are very murky and not well delivered and not often delivered. Thank you.
Excellent. So, Mary, I'm going to ask you, and we'll finish off. I see our time. We have about 4 minutes left. So in the last several minutes, given that a significant proportion of the membership of the Society for Prevention Research are early career scientists, it's our graduate students, it's our postdoc, it's our early career faculty, and these are going to be the next generation of prevention scientists.
Yes.
What advice would you give to them to be in, and how to get involved in advocacy above and beyond visiting their representatives? What are some final words of advice that you would give to them?
So I would say join together with each other. If you haven't already, on your campus, virtually is fine. There are typically science policy groups, including in schools of public health and elsewhere. Get involved, do things together with your peers. And if you happen to be affiliated with a university that doesn't seem as interested in helping you take a role in advocacy, talk to others to see if you can be one of those that leads your university into a much more 21st century approach to maximizing the ability of everyone in the sciences to engage with the public effectively and make a difference for the future of the generation that follows you, as well as yourself.
Great. Thank you, Mary. That's wonderful advice, I think, particularly during these challenging times. So with that said, I'd like to say you won my heart and mind, and I'm sure you did, of many others that are watching. Thank you so much for joining us. We very much appreciated given all of your competing demands. And next time you're with us at SPR, hopefully in the not too distant future, we'll be able to do this in person.
That'd be great. And please be in touch, anybody and everybody. Thank you.
Thank you. Stay well, Mary, and see everyone in 15 minutes in our Health Disparities Invited Symposium. Bye-bye.